Hi.
I'm Angela. I'm going to be your nurse practitioner student.
Okay.
We're going to do your physical exam.
Okay.
Okay? I'm going to wash my hands. Before we get started, do you mind if we do a couple of tests?
Sure.
Okay. If you mind just walking your tiptoes towards me. Great. And then if you could turn around and walk on your heels. Okay, good job. And then if you could come towards me and walk heel to toe. Awesome. Gait is symmetric, even. He is balanced. All right, I'm just going to do a test called the Romberg. If you could just stand real still by your side and close your eyes. All right, it's been 30 seconds. No tilting. Romberg is negative. Wonderful. If you could turn around and face the wall for me, I'm just going to assess your spine, your cervical, thoracic, lumbar. Go ahead and bend over for me. Great, and then sit back up. Your scapula, iliac crest, gluteal fold, symmetric. Go ahead and face me. Maybe you can turn out your hips. Great, and go by your sides. Awesome. Full range of motion, then go back for me. Great. Thank you. If you could stand or sit up right here for me. Just going to assess your hands. Skin characteristics, your tan. Nail bed is pink. Cap refill is brisk. No clubbing. Skin is warm, soft. No lesions noted. Go ahead and squeeze my fingers for me. Grip strength is strong. If you can move out your fingers like that, great. And then if you could put them like that for me, and then push out. And then do this. Range of motion fully. Okay, great. And then we'll do a finger to nose test. If you can put your finger to my finger into your nose, and then we'll rotate. Okay, good job. We're going to test cranial 11. If you could just shrug your shoulders for me. Great job. And if can we just move out your elbows like this, and then go out, and then down. And kind of shrug in and shrug out. Great. And then put your arms up like this. Pull towards yourself and then push out. Great. Strong. Upper extremities. Just going to palpate your head. Any pain?
No.
No deformities noted. Hair is evenly distributed. Go ahead and sit up. I'm just going to check your pupils. If you could look at my nose. All right, corneal light reflex bilaterally. I'm just going to check direct response. Pupils are even, equal bilaterally, and reactive. If you can look at my finger. And we're going to go this way, checking cranial 3, 4, 6. Okay, and then look out here for me, and then follow it in. Great, they're accommodated. We're going to check consensual response. Both pupils constrict. Great. Cranial nerve 7, if you can frown for me, and puff out your cheeks. Great. And then close your eyes. And we're going to test cranial nerve 5 if you can tell me when you feel this.
Feel it. I can feel it. I can feel it. I can feel it.
Great. We're just going to look at your nose. I'm just going to palpate your nose. And then we're going to test cranial nerve 1 if you can occlude one nostril and breathe in. And then do the same for the other. Great. I'm just going to palpate your maxillary sinuses. Do you have any pain?
No.
And any pain in your frontal sinuses?
No.
No. Go ahead and assess your nodes, your preauricular, posterior auricular, occipital, any pain?
No.
Your superficial cervical, your posterior cervical, your deep cervical, your supraclavicular, your tonsillary, submandibular, and submental, any pain?
No.
No. I'm going to look for your axillary nodes. Any pain?
No.
No. I'll wash my hands. Okay, great. Now we're going to look at the inside of your nose. Just look up for me. Okay, wonderful. And I'm going to look at some more of your eyes. So I'm just going to pull your lower lids down first. Okay, conjunctiva is pink, sclera is right, cornea is translucent, iris is the same bilaterally, green in color. I'm just going to do your fundoscopic exam. I'm going to check your red reflex. Okay, red reflex is noted. I'm going to come in super close, okay? Just looking for your retina, optic disc, and vessels. Go on the other side, do the same. I'm going to look at your red reflex first. Red reflex is noted and come in close. Retina, optic disc, and vessels. Now I'm going to inspect your ears. So I'm going to inspect your ears. Any pain?
No.
No? And before that, I'm just going to feel around the external on your eyes. Any pain on your orbits here?
No.
No? Okay. I'm going to look inside your ears. One thing that's different with the otoscopic exam for pediatrics is that they have tubes in their ears. Do you have any tubes in your ears?
No.
Alright, I'm just going to look inside. Canal is pink. Tympanic membrane is pearly gray. Light reflex noted. Umbo and malleus. Look on the other side. Canal is pink. Tympanic membrane is gray and pearly. Light reflex is noted. Umbo and malleus. We're going to do the whisper test. So I'm going to come over here. If you could just space out there, if you can repeat after me. This is cranial nerve 8.
1, 2, 3, A.
Great. And again.
2, 6, 7.
B.
B.
Great. We're going to do the Weber test. This just checks for lateralization on the ears, but we're not going to do that today. I'm going to listen to your temporal arteries for any bruits. No bruits heard, and then I'm going to palpate your carotid and auscultate your carotid as well. Great. I'm going to palpate your radial pulses. There are 3+ bilaterally. And your brachial pulses, 3+ bilaterally. We're going to check some of your reflexes. Your bicep reflex. Okay, 2+ bilaterally. Your tricep. 2+ bilaterally, and then your brachial radial, 2+ bilaterally. I'm going to do your patella, 2+ bilaterally, your Achilles, 2+ bilaterally, and then your Babinski on the bottom of your foot. You can't see it. Is absent. Get that cleaned up. Okay, I'm going to look at your neck and just inspect your neck for any lesions or any pulsations. Do you have any pain in your neck?
No.
No, its trachea is midline. I could assess in the back for his thyroid. It is soft. No pain.
No.
Okay. I'm just going to look in your mouth. I'm going to inspect your teeth and gums. If you could open up. Good job. Great teeth. They're white, straight. Open up even wider. Hard palate is white and dome-like. Soft palate is pink. Tongue is resting in his mouth. That's 12. Cranial nerve 12. Go ahead and stick your tongue out for me. Okay. Cranial 9 and 10. Open up. Say ah.
Ah.
Okay. Uvula movements, cranial 10. No tonsils noted because you had a tonsillectomy. And you can push on. Go ahead and swallow for me. Great. Now we're going to have a seat. And if you don't mind just facing that way, I'm just going to inspect your back.
Okay.
Skin is warm, dry, skin is tan, breathing is symmetric, no use of accessory muscles, no retractions, heaves, or dyspnea. Go ahead and take a deep breath. Okay, good job. I'm just going to percuss in all lung fields. And I'm going to auscultate in at least 6 sites and just take a deep breath for me, okay? Okay. No wheezing, breath sounds are bilateral and clear. No wheezing bronchi and rales, and through on the right side. Two on the left. And no wheezing, bronchi, rales heard. Breathing is symmetric bilaterally. I'm going to check for CVA tenderness. Let me know if this hurts. Any pain?
No.
No? Okay. Go ahead and have a seat back up here for me. I'm going to listen to your lungs in a second, but I'm going to palpate for TMJ. You can open up for me. Okay, no TMJ noted. Skin characteristic is tan. Breathing is symmetric. No acute respiratory distress. Palpating for any lumps, deformities, and 4 sides. I'm also going to palpate your arms to your shoulders for any deformity or edema. Does any of that hurt?
No.
I'm going to listen to at least 4 lung fields on the breathe in. Breathe out. Breathe in. Breathe in. Great. No wheezing, bronchi, rales heard. Breathing is symmetric and clear. Go ahead and lay down for me. I'm going to listen to your heart. Let me move all this stuff out of the way. Okay, you can put it. I'm just going to inspect the recording for any pulsations and palpate. And listen to the PMI, which is at the left 5th intercostal space midclavicular. Rate is even and regular. Now I'm going to listen to the aortic, which is at the 2nd left intercostal space. And pulmonic, which is the left 2nd intercostal space. Herbs, left 3rd intercostal space. And tricuspid is left 4th intercostal space. And mitral left 5th intercostal space midclavicular. And I listen to all sites with the bell. I'm going to inspect your abdomen at eye level for any pulsations. Abdomen is symmetric. Skin is warm. Go ahead and put your chin to your chest for me. Okay, no grimacing. Can you do it one more time? I'm just going to inspect your abdomen. Wonderful. I'm gonna auscultate in 4 quadrants. For at least 20 seconds in all fields, and then I'm going to listen to the aortic artery with my bell, the renal, and the iliac. I'm going to percuss in all quadrants. And I'm going to do light palpation. Let me know if any of this hurts, okay?
Okay.
Any pain?
No.
I'm going to proceed with deep palpation. No pain.
No.
In all 4 quadrants. Palpate the liver, and then the spleen. Okay. I'm going to feel for your femoral pulse. I'm going to auscultate your femoral pulse. And then, oh, sorry, I thought you said something. And then I'm going to palpate the inguinal node. And I'm also just going to go ahead and check your posterior tibial pulses. They're 2 or 3 plus bilaterally. And then posterior pedal pulses, they're 3 plus bilaterally. I'm going to just inspect your legs. No deformities, any pain?
No.
Okay, hair is evenly distributed. There's no pretibial edema. I'm just going to check the range of motion in your hips. If you could lift up for me. And then push back. Great. And then come out. In. And then just going to feel your knee. Great. If you could just push up with me. Push up. Great. And then push against me. Great. And then we'll just stand on the other leg. Okay, full range of motions in hips bilaterally. Go ahead and push down. And then push up. Alright, strength is strong bilaterally. Just going to assess your toes, and your Capri felt is brisk. Nail bed color is pink. Go ahead and push down on my feet. Great, and then push up. Great. Can't see. Let's try again so they can see the video. Push up, push down, good job. And then if you can just move your feet around for me, we'll check range of motion in your ankles and go out and in. Good job. All right. If you could sit up for me. We're almost done.
Okay.
I'm gonna wash my hands. Can you push your chin against my hand? And the other way, and then push your tongue against your cheek. And then the other way. Let me see what else we have. Okay, I'm just gonna have you do a couple things for me.
Okay.
If you could